Hi, everyone. Welcome back to Taking the Lead. And I'm actually here with someone I've never met in real life. That's the first time this has happened on the show. We've met through email and interviews and what have you. But I'm really excited to introduce to you today's guest. It's Jim Weiss, the CEO and founder of W2O Communications. Let me tell you just a little bit about Jim and why he's here today. Like me, he graduated from Syracuse University's S.I. Newhouse School of Public Communications a few years after I was there. He's a member of our board of advisors. I say ours, like, my board of advisors. and at Newhouse, he's the founder of the W2O Center for Social Commerce. I'd show you my Newhouse symbol back there, but then you might see my sweatpants. So we're not going to do that. Anyway, when Jim started what is now W2O, he had a vision to make the world a healthier place by creating the type of firm he was looking for when he was a client. Sometimes you've just got to create it yourself. So let's fast forward nearly 20 years. You're not going to believe what I'm about to tell you. W2O achieved more than $350 million in revenue in 2020, in the pandemic year. And that was an increase of 50% from the prior year, the pandemic year. It's nothing short of amazing. So I think we're all going to learn a lot today about leadership from Jim Weiss. Jim Weiss, welcome to Taking the Lead.
Well, Ken, nice to meet you finally in person. I've heard a lot about you. You work with my wife, which alone I've heard great things. So it's really nice to finally connect.
It is indeed. So we're going to jump right in. How have you changed your leadership style in response to this year-old pandemic?
Well, I'm a person who, I like to say I'm tactile. I like to be in person, right there. Everybody kind of knows that. My Syracuse past is as a Rush chairman of my fraternity. I was very involved in student government at Syracuse as I was in high school. So I really like to be out and about and connected with the people. It's definitely something that I think, is reflected in our values, which we talk about a lot. There's one called Let's Hang, which is about, getting together as much as possible, integrating, collaborating, and connecting the dots. So it's been really challenging inside this virtual world to do that. But the way we did it really almost immediately was getting on a regular schedule of weekly town halls. And I think, reasserting and recommitting to our purpose of making the world a healthier place. I mean, so many things happened beyond just the pandemic, but I also do think the pandemic gave our mission greater purpose, because healthcare, as you know, having worked in the space, has always been a little corner of many of the agencies we've all worked in and grown up in, and nobody knew quite what's going on over in there. What is the stuff they're talking about? Antibodies? What is an antibody? What is a vaccine? What is it? What are these tests? The first thing I worked on at Hill and Knowlton when I got there was an HIV test. So it tells you that, there was a pandemic that was going on, highly misunderstood. We worked for what is now GSK, but SmithKline at the time was introducing the test. And we worked in the healthcare division, and people really didn't understand what we did. We were highly profitable and highly capable. And, I think, of course, now our whole firm is completely dedicated to that. So I think the pandemic gave us additional purpose. And what I was able to do in leading it was by inviting special guests to our town hall, including clients like Sally Sussman from Pfizer, who was leading the way with a Do Something campaign that she was undertaking that inspired us. And we were helping them obviously with the announcement around their vaccine. So it was great to be, and then obviously working with great clients like Merck and others that today announced, their partnership with J&J, unprecedented, working together to make the vaccine in greater numbers, more quickly, working with the president. I think, that mission got so urgent and it became a matter of life and death. A lot of the work we were doing, helping Roche Diagnostics and their testing, and so many of the things we've worked on have been so mission critical that it almost made what we did more important than even me. And that's why I took my name off the door long ago. But the point is, I think, it also helped us in hiring and attracting talent.
Great. So speaking of talent, I wanted to ask you, how have you changed your leadership style? Specifically, you're leading a team of, I don't know, 1,600, I love you call them industry rock stars, right? They're working from home. They're dealing with big challenges, every one of us, and they've got to deliver for your clients day in and day out. How did you adapt your leadership style to the virtual world?
Well, I think one of the best things we did right away was to develop a program that we called FIT. And it was basically, the first word's flexibility. And basically what we were doing is we changed some of the ways we worked in general. So it wasn't just about me in terms of my style, but also how we had to begin working, particularly working moms at home, who had to deal with addressing kids' needs at home. And that, hasn't really let up. We also needed to give a lot of support, for mental health, just for people coping with the situation, people's parents, family members, others got sick, how do we help support and all of that. So we actually, kind of went into also like many did a wartime mode of how do we really support the employees, the people that work here with meaningful things that they helped us inform. So we reshaped our business resource groups, which used to be called employee resource groups. We ended up hiring a whole new staff of people dedicated to diversity and inclusion, which obviously became really critical during the Black Lives Matter protests over the summer. We have expanded, our not only our internal but our external capability in advising clients about that. So I think it, in my personal style, I might be in this box, but my worldview expanded. And I think that has been, it's interesting how that's happened. And I think that has for many of us. And I also rededicated to doing cause related, support of things like, the Black Coalition on COVID. We went headlong into a lot of pro bono work in awareness and, vaccine confidence. We did studies. We supported the California Life Sciences Association with a dashboard that tracked all of the coverage and notable news around COVID-19s that would help all the companies that they could access that as an information resource. We're now working with the Ad Council on their campaign focused on educating and communicating to healthcare providers about vaccines. So it's become, I think, a cause, like I said, and I think everybody feels rededicated to the space we work in. And that's, so I don't, again, is it a change? It's not a massive change. It's just, I think, a reinforcement.
Yeah, but it's funny you said it's not about me, but I'm hearing or interpreting in what you just said a lot about leadership that we've supported and endorsed. The notion of purpose and vision, the importance of empathy for your people, flexibility, and the ability to pivot. Those are four really powerful leadership attributes. I'm going to guess they were part of your makeup before, but it sounds like you've tapped them especially well.
Well, there's one called listening, and I don't know if you'll get that in the other questions, but I'd say that universally has gotten better. I become a better listener in this box.
So important. So important. It's funny the things that when we go through adversity, the skills we can develop or need to develop or choose to develop, in those times. I've always felt we are going to get through it. It will be different, but I think it will be in some ways better. Obviously terrible about those who have lost their lives and their families and those that, will continue to. At the same time, for leaders, they've really been battle tested. And I think some are going to come out much stronger. And I think some organizations are going to come out much stronger. So, we are feeling the light at the end of the tunnel, vaccine availability. But some are saying that, not but, and some are saying we won't get back to something close to normal till fall of 2021 or even spring of 2022, a year from now. So, what are you doing as a leader to be effective through the long haul, through, some uncertain or even exhausting times that are going to be with us for a while yet?
Well, we're going to continue the town halls like I had initiated so that we're engaged and listening. We're sending out um, our perception studies around DE&I that just went out into the system to make sure they know we're committed, that the staff know we're committed to that initiative and we want their input and continue. We're continuing to support and expand the business resource groups. I hired a new chief people officer who's coming out of Uber. They were recently acquired by Uber, so that's a tech person. As you know, we've invested heavily in tech and data that transforms communications. We have the philosophy that communications is actually much more powerful than just communications for itself. It's actually a player in the value creation, and it's a player in potentially better outcomes in healthcare. And nothing like this pandemic has shown that more clearly, that clear, accurate information, not disinformation, will lead to better outcomes. And we're taking that to the bank. I am rebranding the company. We've done, as you know, that growth has come both through organic growth and hiring, but also acquisitions. So we're coalescing what has been about a dozen acquisitions over the last, I'd say, 3 or 4 years, maybe 5 years, that we're going to bring everyone together under this new era we're calling real chemistry, that is going to be, I think, an exciting, new company in the world that's almost like a healthcare innovation company applying communications as a factor to improve healthcare. And we really believe that, that's going to be an interesting new investment thesis in the space. We're certainly hearing that from not only our customers and clients, but the investment community as well. So I think all these things are inspiring the team to keep going and realizing there's more mountains to climb and more exciting things to come. And there is, as you said, light at the end of the tunnel. We'll keep working hard. There's many more things. And we're privileged because we know what's coming. We get to work at the edge of that, right? We're able to announce these things along with our clients. We see it happening in real time. And so this has been something we've understood well. And I feel like we've been part of the solution. So when you feel like you're part of the solution, either through doing purpose-driven work or you're doing the actual client work that you're getting paid for, you couldn't ask for more.
Yeah. And, talk about inspiring, and inspiration is such an important leadership tenet. I could ask you 5 or 10 more questions, but I'm only going to ask you one more. Tell us a bit about the work you're doing to support vaccine confidence, please.
Well, I did refer to it earlier in the podcast. Probably the most significant work we jumped right in on was work around helping the Black community get more confident. And we teamed up with the Black Coalition on COVID. We had a person who was well connected to that organization, Jewel Jones, out of my DC office. And she worked with Reed Tuxon, who's become, a good friend of mine. And we're out on the stump, if you will. He was just featured on CBS Sunday Morning talking about the topic. I think I just saw today one of the first Black churches that opened up a vaccine center. So we're seeing it lead to action. I've certainly had people call me and say, your work directly got, my mother or father to take it, which is so terrific because we need everybody to go in. But there's a lot of historical, barriers as to why, people didn't feel they wanted to take it. There's other barriers like, women of childbearing age or thinking about having a child, can I take it if I'm pregnant? Can I take it, if I have other, confounding factors in my, medical history. So these are all things. And then the work we're doing with the Ad Council to support the efforts around educating healthcare providers. We're out there working in partnership with our clients to do quite a bit of this work. So it's not just about promoting the data and the science around the actual vaccine itself. We just fielded not a Harris poll, because you've seen the Harris polls, and our data is actually a little bit contradictory. It's more of what the online world says, and it's really based on what people truly search for and what they really do and what they really say. And actually, there is more confidence than you might be led to believe from polls. People are looking and searching and trying to find out more. And I think we're a little bit more optimistic about, people going out to seek it. And the more they're given credible information, not that this is shocking or surprising, and the more they see peers in their community, not necessarily celebrities, but peers in their community, and the more they are met where they are and not educated as if they're uneducated, if they're treated and communicated to like adults, they will more than likely take the vaccine.
That's good news. And, hopefully by the time we share this in April, we'll have a lot more shots in arms.
You will. You are. It's already happening, but you will. And like I said, the industry I've served and came out of for so many years is really, stepping up, has stepped up. And I'm really proud of what's happened.
Good to know. Hey, this was really an enjoyable few minutes, and I thank you for the
Thanks,
time.
Ken.
It's nice to see you virtually, maybe someday in person. That would be nice.
It'll happen.
It'll happen.
We're gonna get to New York soon.
Thank you. Come down to Asbury Park. It's a cool place. We'll be reopening soon.
Good.
Thank you so much. We'll see you next time.
All right. Take care.